So tell us a little bit about your background and how you started working here with the ARMS clinics.
Okay, I am originally from New Jersey, and I came to Alabama to work. I was a scholar with the National Health Service Corps, so I had to work in an underserved area. And over the years, I just really developed a love for this particular patient population, working with the underserved, and that's how I came to ARMS. They were looking for an OBGYN provider, and I came on staff and love it. And over the time that I've been here, I ended up becoming the medical director. So now I continue to see patients as an OBGYN, but in addition, I serve as the medical director here.
And how long have you been working here?
I have been here since 2017, so 3 years.
That's awesome. That's awesome. Well, I'm so glad that you have found your place here and you like Alabama, because a lot of people can't stand the heat in the summer.
Oh my goodness.
There are other things you have to, that people don't like, but that's great. So tell us a little bit about the clinics and the patient population that y'all serve.
So Alabama Regional Medical Services has been in Alabama, or Birmingham, for about 35, 36 years. And we have several different locations through the city of Birmingham. We have a dental clinic in addition to a school-based health center. So we really do serve the greater Birmingham area. Our goals in the future is to be able to move outside of Birmingham, move outside of Jefferson County, and be able to service some of the other communities that need to have primary care. So that's our focus. We do majority primary care, general medicine, we have podiatry services, pediatrics, dental services. We added behavioral health, which has been growing rapidly since we started that in the past year or two, in addition to OBGYN services. So that's the most, and we added optometry services this year as well.
Okay. What's a typical day for you like, as far as just the number of patients and that come through the clinics?
So for me, I work here at our northern location, and I see patients every day from 8 to 12, 8 to 1. Mm-hmm. And our clinic is busy from the moment we start until the moment that we finish. And we really try to fit in walk-ins during that time. And that's just not for me, that's for the other providers as well, because sometimes something goes wrong, you still need to be seen. So we try to accommodate patients that way. For that acute issue, and then if it's something more long-term in terms of like just your annual care and visit, then we'll bring you back for that visit where we have the opportunity to spend more time with you. So for me, a typical day is really a combination of both OB patients and GYN patients, and sometimes I have to leave out to do deliveries as well, and scheduling surgeries in the hospital, but we also do some office procedures here as well. So we're a full scope OBGYN practice. In terms of the care that we provide for women.
Okay. Now I know that you're a federally qualified health center, but you also see patients that have insurance, all the way to the ones that don't have any insurance. Is that correct?
That's true. So the majority of the patients that we see fit into may have Medicare or Medicaid, but we do have a large proportion of individuals that don't have any insurance. So we take all insurance, but we also see anyone who needs to be seen regardless of their ability to pay. And we base that on a sliding scale, so depending on what your income is, including zero, that helps us determine how we can help you best.
Okay. What are some of the challenges that either you as a provider or ARMS faces, here in Jefferson County?
I think the biggest issue is you have a group of individuals that are underinsured, so they need specialty services that we can't provide. Maybe they need a cardiologist, or maybe they need a colonoscopy, or they need to see a GI specialist or a dermatologist. We don't have those services here. So it's trying to coordinate that care for that patient, for that person. So that's the biggest challenge. But sometimes Certain things are more expensive than others. We do provide quality health care, but some items we can't afford because they're just too expensive. So we want to be able to provide that service for them, because the more we can do here, the less people have to go outside for. So I mentioned some of the services that we have, but I forgot to mention we do ultrasounds. We have a pharmacy. So all of those things allow for a patient who's underinsured to be able to have everything in one site. You don't have to go and spend money someplace else to have an ultrasound. We can provide it at a lower cost here. We also do x-rays in one of our other locations, so it would be cheaper if the patient could have it done here. But the equipment is expensive, so that sometimes limits how much we can do in some of those ancillary services just because of cost.
Okay. So does your clinic serve the largest population of all the clinics that are offered at the Alabama Regional Health Services?
For the northern location, I think I will say yes. There are other clinics that are more busy, but we have many more specialties in one site. So this is the largest site. So we have optometry, podiatry, OBGYN, ultrasound, and general medicine, and pediatrics, all in one building. So the clinic flow is very busy with people in and out of the waiting room all day. Thankfully, pediatrics has a separate waiting room, and so does OBGYN. So that helps out on flow. But there are other clinics that are busier than we are in terms of general medicine. But we are the busiest in terms of so many specialties in one place. And it's really nice to be able to provide that, so when a patient walks into the door, they can have all of those services. And I keep forgetting behavioral health, but we have behavioral health here as well. And we have one other location where we do behavioral health. And one of our goals is to be able to provide, I mean, we can do it either way, either have more behavioral health specialists where each site can have a behavioral health specialist, or we really just have to get the software so that we can provide telehealth for behavioral health. So they can be on site here at Northern, but then have their visit actually at our Crestwood location, our Inslee location. So that's one of our goals moving forward, is to be able to provide that service.
Okay. You mentioned continuity of care, and when a patient comes here but then needs to be seen by a specialist that's not, within the building, how is that working? I mean, I know that's a challenge, because then they have to figure out how they're going to get transported and things like that. How is that for the patients, and are there other areas that you need some help in that area to help facilitate that continuity of care? Right,
for sure. And actually that's two things. One is the ability to get to your appointment, and sometimes that is an issue. And there are some programs that will help out, but we're always looking for more programs to kind of help with those, what we call social determinants of health. What are those other things that patients need that we can help them with? And sometimes transportation to an appointment is the issue. We can't pay, we don't have enough funds to pay for someone else's consult. I can make your appointment for a consultation, but then that office may have a charge if you don't have insurance. So how do we mediate that? And that's one of the things I won't say the city of Birmingham is working on. There's a lot of changes going on in the city to see how we can improve on that process to provide that continuity of care when specialty services are involved. So it's not a large out-of-pocket fee, and the process is not too cumbersome when you have someone who needs to see cardiology, or they need to see some other orthopedics, a really important specialty. We want to be able to make that process easier for the patients. And one of the things we have, people call it different names, like patient navigators, or we call them care coordinators, someone who's checking up on you to make sure you got to that appointment and try to decrease those barriers to get you to the appointment.
Yeah, because we all know that if they need to go to see a specialist and they don't, and then they put that off, next time they're seen is probably going to be in an emergency department somewhere. So I can see how that's a struggle, for them.
Exactly. And thankfully for patients who do live in Jefferson County, they do have another outlet to get there through the Cooper Green system, but there are improvements that are being made in that process to make it more seamless. Like I had a patient the other day where you want to be able to know that a person had an appointment versus hoping that they get an appointment.
Right.
So.
Right. Now you mentioned earlier that that you would like to potentially offer a few more services, but also expand your clinic outreach. Tell me a little bit more about that.
Well, there's a lot of need, and Birmingham is great, and there's lots of health centers here, and we want to maximize what we do here. I would love to have a better radiology ultrasound connection so that we're able to do more tests in-house, because that means that I can provide that service at a lower fee. You can have it done here. You trust us, you know us. So that always works really well. In fact, I had somebody the other day where the ultrasound person was on vacation, and the patient was just kind of disappointed that she couldn't just have it here that day. So it would be great to have that continuity with those diagnostic services. One of our goals is to expand our HIV. We want to have an HIV program and be able to offer those services to that that patient population. So that's something that we're working on. In addition, if we could even hire like a part-time cardiologist ourselves to be able to say, hey, can you give us 2 days a week, and we could build a schedule for you. And the last thing, which would, you have to choose which ones you could do, but it would be great if we had a relationship with another GI specialist as well. Just some other partners who are willing to come in and give it their time and efforts, kind of sharing that load for all the things that the community needs. And then you think of moving outside of Jefferson County. Again, it's all about trying to expand our scope of practice and being able to help as many people as we can, because you don't have to go far. A lot of those people are already coming into Birmingham. Some of the people who live in Shelby County don't have a place to go other than the health department there. So they come into Birmingham for their care. And it's nice when you're able to go to a doctor right in your area. Like my dentist is right up the street from my house, makes it easy when I'm trying to coordinate appointments. So we want for other people to have that same value, that they have somebody right there. And it's one other thing that I wanted to mention in terms of growth for us outside of Jefferson County, but I'm sure it'll come back to me in a second.
That's okay. Well, that's all the questions I had for you. I just wanted to, again, thank you for your time. Thank you for your partnership. Thank you for enabling us to be able to give you some supplies and equipment. And we're hoping that you'll be able to use everything that we donated because it was on your list. So we're hoping also to continue the partnership in the future. And a lot of that's dependent, as you know, on us potentially getting funding or grants. So anyway, it's been exciting to see what y'all do here and see what we can do to help you out.
Absolutely.
Your services. So.
We are overwhelmingly grateful for everything that you've done. Just, for even starting such a business, like we didn't know that we needed that until it was here. So we're very grateful that Hub even exists. And we're grateful that you decided to partner with us and just really help our patients, the colposcope and just the different things that help us in our daily runnings of the clinic, from, cotton balls to blood pressure machines. It's really a great addition, because we all have wants on our list, and so we get what we need, but it's nice when you're able to get some of those wants as well. So as I speak for the entire organization and definitely some of the providers that you have helped us in terms of the Dopplers and the scales, like everyone is just greatly appreciative. Or sometimes when you say, oh, this organization is here, or this person is from here, they say, well, who was that? Oh, that's the company that gave us such and such. And then they perk up. Oh, well, you better get in there. You need to go meet her because we are so thankful. So it's really nice, and that's what we try to do, just help tell people who gave it, right, and why, and so they can spread the word too.
Yeah, that's awesome. Well, thank you again.
You're welcome.